My name is Bruce Conniff. Like she says, I'm a technical instructor trainer. I'm also a hyperbaric chamber instructor. I run courses with hyperbaric chambers. I'm DMT qualified. What I wanted to do is today is just to kind of tell people a little bit about hyperbaric chambers and exactly what it does and stuff like that. And just try to make people a little bit more aware of what actually hyperbaric chambers are actually used for in that. Has anybody out here, has anybody ever been in a chamber before? Has anybody ever been, you been in a chamber, you've been bent before? No? You were just, what, working as a tender or something? Oh, okay. I've been there, done that. I think it was about 20 years ago is the first time I was doing a trimix dive here in Thailand. About, wasn't that deep a dive, about 84 meters or so. And actually I come up on the dive and I had pain in both my shoulders and stuff. And ended up going to the Thai Navy Hospital down in Samisan and getting treated in the chambers there. It was a turning point for me. A lot of people that I've talked to, they said if I ever got bent or a DCI, they'd end up diving. To me, I kind of took it the other way and started getting a little bit more into diving medicine and into treating people with decompression illness and healing of wounds and that. The chamber, when I had gone down to Sada Heap about 20 years ago, when I first went in there, I had no idea what to expect. I didn't know if it would be, if it was modern, if it was up to date. Yeah, I didn't know what kind of facility they had there. I was actually quite surprised when I had gone down there. When I walked in there, it was very professionally run. From my experience with chambers before and being a chamber operator and stuff, I started asking questions. Hey, do you got this? Do you got this? Do you got this? And they start rattling off. Yeah, they had everything there. They had a big staff running the chamber where everybody takes turns running the chamber. Sometimes they would operate the chamber from the outside. Sometimes people were working the chamber on the inside. And that's a little about what we were going to talk about today. Yeah, what we're going to talk about is hyperbaric chamber awareness, a little bit of an overview about hyperbaric and hyperbaric oxygen therapy, what we'd actually in short terms we call it HBOT. That's okay, I think. That's okay. What is HBOT? It's actually hyperbaric oxygen therapy. It's breathing oxygen, not air. Actually, you would see the big green bottles. It's just like some people call it 100% oxygen. It's very close to being 100%. Hyper means it's above normal conditions. Barrel or bar, meaning atmospheric pressure. And it's the HBOT. It's a method of administering high dosage of oxygen at greater than atmospheric pressure. Okay? By providing pure oxygen in a pressurized chamber, you are able to deliver 10 to 15 times more oxygen than if you deliver at a normal pressure. By using a hyperbaric chamber, how this actually it helps by putting in a person into a chamber, as it's being called hyper, is like your heart is pumping oxygen to the parts of your body. But the farther away from it, like down in your feet and that, the oxygen's got to travel a long way. If you got poor circulation of any kind, or if you've had surgeries of any type, by pressurizing the hyperbaric chamber or pressurizing the oxygen in that, it actually helps to get the oxygen to the different parts of your body where it's kind of being deprived of the oxygen. Hyperbaric medicine originated from treating scuba diving injuries. Most people have actually heard of the term of the bends. it's actually, then it's basically what they're talking about is decompression sickness, and more recently we call it decompression illness. But when everybody heard of the hyperbaric chambers, actually what they were thinking of is just divers that were getting bent and divers getting treated in the chambers. One of the most popular is, like you see some of the hookah divers with they're breathing from the hose or with the compressors, and they go down. They don't have a great deal of knowledge on what they're actually doing. It's actually very, very dangerous doing the hookah diving and that. They have no idea about tables, how long they could stay down for. They're thinking, oh, the compressor, it's got, gas. I could stay down there for 2 hours if they keep putting gas. I could stay down there longer. And that's not true, because the longer that they're actually down there, they're absorbing nitrogen into their body. And when they would come up, they were, getting pains in their joints, and they were, feeling sick, and they didn't know what was happening. One time I spent some time down in Samyasan at the Thai Navy Hospital. I spent a few months there gaining a lot of experience, and I was building up my hours for my CHT and that. And most of the time when we were doing treatments and stuff like that, it was mostly for healing wounds. One day, actually, there was a call. They rushed some guy in. He was actually paralyzed. He couldn't walk. They brought him in on a stretcher and stuff like that. They actually brought him in from down south Thailand because he was told that they could give him an injection and it would make all of his pain go away. But I think they kind of let him know how he could be treated. The guy couldn't walk, but after treating him in the chamber, after a couple of treatments, he was actually able to walk again. If he didn't get that treatment, it's very likely that he could have been paralyzed for the rest of his life. But with the diving medical officers down there and the training staff, a couple of treatments, and he was able to walk again. And he was, an injection doesn't help, but it's actually the treatment by the hyperbaric oxygen. How can breathing more oxygen help me? A moderate increase in pressure will dramatically increase the amount of oxygen that will safely be delivered to all the tissues in the body, even to places that naturally restricted blood flow, like the body's white tissue, and also tissue with lower than normal flow and even blockages in that. If you've had some type of surgeries and that where they cut you open and stuff, it's damaging the tissues, which can actually decrease the flow of oxygen going through your tissues into the different parts of your body. Actually, if you get decompression illness, you have a more likely chance of being able to get it again. It's easier to be able to get it the second time because of the tissue damage that is actually done from the expanding of the bubbles that going through your system, and that it expands and it tears the tissue, and it can actually happen again. Why does hyperbaric oxygen work better than standard healthcare administration oxygen? The difference is the pressure. The total volume of oxygen delivered to the tissues is the sum total of the oxygen contained in a fully saturated hemoglobin plus the amount of dissolved in the plasma. When we pressurize the plasma, it absorbs the oxygen in the same way that water under pressure can absorb CO2 to produce carbonated water. I'll give you a little bit idea of actually how the chamber works. If somebody's actually being treated like a table 5 or a table 6 is the US tables that they treat for used for treating decompression illness, they actually take the person down to 18 meters. And they put them on, when they get down to 18 meters, they're breathing oxygen. When you're breathing the oxygen, the partial pressure of oxygen is actually 2.8. And so it's flushing, you're not, with the decompression illness is actually caused by the inert gas by the nitrogen bubbles or the helium bubbles or whatever. But when you're breathing 100% oxygen, you're not breathing any more of these inert gases, and it is getting the inert gases out of the body, the nitrogen and the helium. So the higher pressures of oxygen is what helps to treat the patient. I don't want to get into too much detail on this, but it's a lot of the people that are divers know about Henry's law of solubility. When a gas is in contact with a liquid, the solubility of the gas varies in direct proportion to the pressure of the liquid. When a gradient is created, you have diffusion occurs, which is the pressure gradient of the internal and the external pressure gradient. Here's to give you a little bit of example. When gas molecules are in contact with the liquid gases, they diffuse into and out of the liquid in relation to the pressure on the liquid. After a period of time, the molecules will dissolve in the liquid by diffusion. The rate of the diffusion depends on the gradient, or the difference between the internal and the external partial pressure of the gas. How does a person actually get like decompression illness? When they're down there, they do a dive and they go down, the deeper that they go, the more nitrogen or like the helium, the inert gases they're absorbing. And when they come back up, you have to ascend at a pace usually about 9 to 10 meters per minute, but then you have to do stops. These stops actually give you time and actually to breathe more oxygen. It's a different gas with it has more oxygen in it. That actually, by doing we call them decompression stops, to actually to off gas the inert gases that are in your tissues. When the gas molecules are in contact with the liquid, gas diffusion into and out of the liquids in relation to the pressure of the liquid. I've already gone over that one. Okay. Okay. What can hyperbaric oxygen therapy do? There are 6 primary things that HBOT will do. HBO is a vasoconstrictor. It therefore reduces edema. The reduction is swelling, and inflammation often occurs after the first treatment. HBOT promotes, I can't see without my neovascularization. When oxygen levels are increased, fibroblasts divide, producing more collagen and new capillaries. HBO enhances the killing power and activity of white blood cells. It boosts the autoimmune system's effectiveness. HBO kills the anaerobic, the bacteria. HBOT is effective in fighting many infections and is bactericidal against the amoebas and anaerobes, and stop the exotoxin production. Even people after having surgeries, when you have have a surgery on different things, people are being use of the hyperbaric chambers are not just used for decompression illness anymore. Actually, down when I was logging a lot of time down at the chambers and stuff like that, maybe out of 6 months, you might have 1 or 2 treatments of actually somebody getting decompression illness and have to treat them. However, we were running treatments every single day, and we had 3, 4, 5 patients every day using the hyperbaric chambers and that. And it's for healing wounds, and this is what the oxygen is actually doing to the body, and helps to heal the tissues quicker than what you would do normally. I mean, if you weren't on HBOT. So actually, we use different tables on how we treat people. For people with the DCI net, we had the longer tables.